Yeah, let's continue our discussion about antihypertensive agents. This morning, we will be discussing drugs that alter sympathetic nervous system function. So that includes the drugs that act on both alpha and beta receptors. Yes, I think so. I have, if I'm not mistaken, I have already uploaded this in Schoology. Itong PPT na ito, chapter 17 ito, and yung diuretics, chapter 18. Pila ka syringe. At least 5, depending kasi kung sa makahawd mag-administer. Okay, anyway, let's start. Drugs that alter sympathetic nervous system functions. Let's have a little review about the sympathetic nervous system. This is our fight or flight system in the body, and this is highly governed by our postganglionic neurotransmitter called norepinephrine. Okay, though epinephrine has also an important function here, but epinephrine is more of a hormone than a neurotransmitter. Okay, that is due to their origin. Remember, norepinephrine is released by adrenergic neurons, while our epinephrine is released by our adrenal medulla. Okay, now both of them, when released in their site of production, they can bind to the available receptors. Okay, and we have 2 types, alpha and beta, though all in all that will be a total of 5. We have alpha 1 and alpha 2, beta 1, beta 2, and beta 3. Now, starting from alpha receptors, alpha 1 receptors major location is the blood vessels. Once these alpha 1 receptors in the blood vessels are activated due to the binding of either the norepinephrine or epinephrine, then there will be vasoconstriction, and that in turn will lead to increase in blood pressure. Okay? Yun yung ating alpha 1 receptor. Aside from norepinephrine and epinephrine, other drugs can also bind to this receptor, the alpha 1 receptor, and elicit a pharmacologic effect. Therefore, we call that alpha 1 agonist. Okay? Pag pag merong binding, there is affinity to the receptor and there is pharmacologic action, we call that agonist. However, we also have drugs that will only bind to these receptors and will not activate it. There is no intrinsic activity. That's what we call antagonist. So we will be discussing this morning both agonist and antagonist sa mga receptors na ito. Alpha 1 again is found in the blood vessels, while alpha 2 is a presynaptic receptor. So when you say presynaptic receptor, that is found before the synaptic cleft. Okay? And if we are going to activate this receptor, this will result to the inhibition of further release of norepinephrine. Again, inhibition of further release of norepinephrine. If na-inhibit na niya yon, wala nang masyadong norepinephrine na mare-release, and that will limit also the binding of these transmitters to alpha 1 receptors. Wala ding activation that will lead to relaxation of the blood vessels. So this will be an opposite effect of the alpha 1. If alpha 1 can constrict the blood vessels and cause increase in the blood pressure, alpha 2 can relax the blood vessels, and that means there is dilation, and then that will lead to the decrease in the blood pressure. So that is the reason why when we say antihypertensive agents, sympathetic nervous system is always included. That is just for the alpha receptors. Remember, we also have beta receptors. The beta 1 receptor, which is found mostly in the heart. And activation of this receptor in the heart can cause increase in the heart rate, in the conductance velocity, and also the force of contraction. So definitely, if we are going to administer an antagonist, that will be the other way around. The patient will experience decrease in all these things: heart rate, force of contraction, and conductance velocity. Now, all of these things also is connected to hypertension. So once again, it's not just about alpha receptors. We will also be discussing beta receptors here for our anti-hypertensive agents. Okay, so let's start. We have centrally acting sympathoplegics. Again, centrally acting sympathoplegics. These are drugs that act on the sympathetic nervous system, but this one is specific kasi may nakalagay dyan, centrally acting. It means on the brain. Their action is on the brain cells, the receptors found in the brain, and it's actually the alpha 2 receptors, which is located presynaptically. Okay? Yung target talaga ng 4 na drugs na ito are the alpha 2 receptors, and they are agonist to the alpha 2 receptor. So take note of the mechanisms of action. Alpha 2 agonist. If we are going to activate the alpha 2 receptor, that will inhibit further release of norepinephrine. That's what you mean by inhibition of sympathetic outflow in the periphery. So yan yung ating mechanism of actions of these 4 drugs. So when you are asked what are the centrally acting sympathoplegics, we have 4-METHYLDOPA. Brand name of this in the market, which is common, is Aldomet. And then clonidine, brand name is Catapres. And these 2, guanfacine and guanabens, though they have the same mechanism of action, but they are not really commonly used. Therefore, even in your community or hospital internship, I doubt if you are going to encounter these 2. Itong methyldopa and clonidine, may encounter nyo pa. Pero itong dalawa, hindi na talaga sila ginagamit for treatment. Okay? So again, centrally acting sympathoplegics. Centrally acting means their action is in the vasomotors or vasomotor cells in the brain, leading to the activation of the alpha 2 receptors. And we have series of things that will happen also. There is inhibition of the further release of norepinephrine, leading to relaxation of the blood vessels, and then there will be dilation. After the dilation will be the decrease in the blood pressure. Okay? Yan yung gagawin ng ating 4 na drugs. Now, let's get to know them one by one. We have the METHYLDOPA. Again, the common brand name in the market for our METHYLDOPA is Aldomet. Okay? Yan yung common. Aldomet. So, from the name itself, METHYLDOPA, this is actually an analog of L-DOPA, which is inside the body will be converted to 2 metabolites, alpha-methyl norepinephrine and alpha-methyl-dopamine. So from the name itself, they are closely related to dopamine and norepinephrine. These 2, especially methyl norepinephrine, will act as a pseudo-neurotransmitter. It's a false neurotransmitter. Okay? And then, itong false neurotransmitter na ito is capable of crossing the blood-brain barrier, going to the brain, and the target is the alpha 2 receptor. After binding to the alpha 2 receptor, it will activate that receptor, again, leading to those things I have mentioned a while ago. And ang pinaka-effect will be the decrease in the blood pressure. Okay? So when are we going to use this METHYLDOPA? If our patient is hypertensive and at the same time pregnant. What is the reason for this? Most of our antihypertensive agents are considered carcinogenic. No, not carcinogenic, teratogenic. When you say teratogenic, these agents can cause deformities sa baby. And we have METHYLDOPA, which is considered safe kasi hindi ito teratogenic. However, since METHYLDOPA can cross the blood-brain barrier, it can reach the brain, therefore the toxicity will most likely be on the CNS also. So as you can see, METHYLDOPA can cause sedation or impaired mental concentration, including nightmares. The patient may experience also vertigo and mental depression. So therefore, if the patient class has depression, clinical depression, we do not use this also to that patient. Okay? Huwag niyong ibigay kasi samot ilahang depression. Not really, these antihypertensive drugs cannot really cause abortion. So iba yung abortifacient drugs natin sa teratogenic. Si abortifacient drug can really abort the fetus if taken by a pregnant woman. But when you say teratogenic, the baby will still be there. However, when born, most likely may deformities. Most of the time, it's physical sa limbs, sa kamay, sa paa. Yun yung mangyayari kapag pregnant ang babae. Tapos magte-take, especially yung mga ACE inhibitors natin, yung mga nag-e-end sa prils, they are considered teratogenic. The sartans also. So be careful of using these drugs to pregnant women. Okay. Now, another thing that you have to know about METHYLDOPA is the development of positive Coombs test. Actually, I'll be specific with this. It is false positive Coombs test. False positive ha. Coombs test class is a test to determine if a person has hemolytic anemia. Hemolytic. Maghe-hemolyze yung mga red blood cells. So it's another form of anemia. And we are doing Coombs test to check, to really determine whether that person has hemolytic anemia or not. However, if the patient is taking also METHYLDOPA, there is a high chance that the patient will have a false positive result. So magpa-positive siya even though wala naman talaga siyang hemolytic anemia. Okay, and that is due to the presence of the metabolites of METHYLDOPA in the body that will have interaction during the diagnosis. And what do you mean pero ang baby ma'am possible rin? What do you mean ang baby possible rin? Possible maunsa. Possible. Hindi naman. Sa testing lang ito. Magkakaroon siya ng parang interaction with the test. Okay, so any question about METHYLDOPA? Have you seen METHYLDOPA during your internship? Either in the hospital or now? I believe you are starting already with your specialization in the community. So yes, METHYLDOPA is still in the market and it's very useful for pregnant women with hypertension. Though it's not really that much used for patients na yung may hypertension lang. Mas pinipili kasi yung ibang drugs that are considered more effective and more potent. Yeah, pag anak kay na ay deformities ang baby, pwedeng wala siya kamot, wala siya tiil, or kulang iyahang tudlo, or sobra iyahang fingers, ganon. Yan yung mangyayari if substance given to a pregnant woman is teratogenic. Wait lang. Okay. Anything else? Wala. Let's move on to clonidine. Not really. Kasi it's just a teratogenic agent. It's not an abortifacient. So, ang abortifacient natin, yung mag-a-abort talaga ng fetus. Most likely, teratogenic will just cause deformities. Okay? Then we have the clonidine. So this is still a centrally acting sympathoplegic wherein the effect will be in the brain mismo, but for the receptor, this is still on the alpha-2 receptor. So it binds more to alpha-2 than in alpha-1. Therefore, when the alpha-2 receptor is activated or stimulated, has the same effect to that of the METHYLDOPA. But when it comes to the effect, this is more efficacious in lowering the blood pressure compared to METHYLDOPA. The common brand name in the market is Catapres. Okay? And hindi din ito mostly ginagamit for like mild to moderate hypertension. We actually reserve this drug for patients na hindi na nagre-respond to 2 or more common antihypertensive drugs. So again, clinical application, hypertension that has not responded adequately to treatment with 2 or more drugs. Okay, or we are going to use this to patients with hypertension complicated by renal disease. That's the use of Catapres or clonidine. Now, just like METHYLDOPA, since this is centrally acting sympathoplegic, this has the ability to cross the blood-brain barrier and thus causes mental na mga toxicity, CNS, including dry mouth, though we have sedation here. And just like METHYLDOPA, the patient may be at risk of having depression. Or if the patient has depression na, we don't give clonidine to this patient. Mag-aggravate yung depression. And aside from that, clonidine class is widely known to cause withdrawal symptoms when you are going to stop the treatment abruptly. Okay? So, ano yung kanyang magiging effect? It will be hypertensive crisis. So, imbis na ginagamot natin yung hypertension ng patient natin, but if the patient stops this drug abruptly, then as in mag-shoot up ang blood pressure. So, it can cause hypertensive crisis. Therefore, how are we going to stop the treatment using clonidine? You have to taper the dose gradually. Okay? Hinay-hinay, i-decrease yung dose ng patient until mag-stop. Kasi pag abrupt, there will be again withdrawal symptoms in the form of hypertensive crisis. Now, the other two that are not really commonly used nowadays. We have the guanabens and the guanfacine. The names inside the open and closed parentheses are the brand names. They have the same mechanism of action with that of methyldopa and clonidine, acting on the brain's alpha-2 receptors. Okay? However, why are they rarely used? Kasi mas toxic sila compared to the two. Okay, so you will not really find this sa mga drugstores natin in the community. Okay, you have questions about our centrally acting sympathoplegics before we'll move on to the ganglion blocking agents. So, alin doon yung part na hindi naintindihan? Kaya itong usabon. Yeah, we have 4 centrally acting sympathoplegics. Most of the drugs class that can cross the blood-brain barrier are non-polar drugs. The crossing is dependent on their structure. If their structure class include functional groups that are considered non-polar o kaya hydrophobic, then yun yung drug class na makaka-cross sa blood-brain barrier. Okay, that again, if you are asked what determines the crossing ng drug sa papunta sa brain, it's their lipophilicity. It's on their structure. So if we're going to look at the structure of this sympathoplegic agents, especially methyldopa and clonidine, we will really see there that they are non-polar. So makaka-cross talaga. Okay? Since our blood-brain barrier is made up of lipids, most likely ang i-allow niya mag-pass through yung non-polar, mga lipophilic drugs. Anything else? Wala na? So are we going to move on now to our ganglion blocking agents? What do you mean again by ganglion? Who can still remember what is a ganglion? Ano ngayon sabi ko sa inyo nito?
Junction between the neurons, ma'am.
Okay, sorry, I was not able to get it. But anyway, yes, that is correct. That is a space between, that is a junction between one neuron to another neuron. Okay, again, that's a junction or a space between two neurons. And for the autonomic nervous system, the ANS, both sympathetic and parasympathetic, remember we have 2 neurons for both, ha? Therefore, we have ganglion there. Now, my question, in the ganglion of both sympathetic and parasympathetic nervous system, what is the neurotransmitter? Okay, both ha, sympa and parasympa. The neurotransmitter in the ganglion is, that is correct, acetylcholine. Okay, acetylcholine. Therefore, if we're going to talk about ganglion blocking agents, these are drugs that inhibit the receptors found in the ganglion, and we are actually inhibiting the action of acetylcholine in the ganglion. Kasi yun yung neurotransmitter natin dyan sa part na yan. Okay, so take note, mechanism of action of our ganglion blocking agent, competitively block nicotinic cholineceptor on postganglionic neurons in both sympathetic and parasympathetic ganglia. So let me write sa screen. Wait lang. Saan nga yung pen ko? So ganito yung mangyayari. Remember, we have neuron, we have another neuron. Wala lang na siya. Dapat shorter ang isa and longer ang isa na. Pero anyway, ganglion here, we have the ganglion. And then we have, syempre, the acetylcholine here. Now, since we are talking about acetylcholine, syempre, ang receptor niya, yung para sa kanya talaga. But that will be in the form of the nicotinic receptor. Di ba? We have two receptors for our acetylcholine, the muscarinic and the nicotinic. But this time, ang pinaka-involved talaga na receptor in the ganglion is the nicotinic receptor. If you're going to give the ganglion blocking agents, this one will be inhibited. Therefore, the activity of the acetylcholine will also be inhibited in the ganglion, and that is for both sympathetic and parasympathetic ganglia. Okay, we have again the same neurotransmitter for both sympa and parasympa in the ganglion. So mai-inhibit si nicotinic receptor that will actually supposedly accommodate the acetylcholine. Okay? So yung ating mga ganglionic blockers may also inhibit nicotinic receptors that are found in our neuromuscular junctions in the body. So hindi lang siya totally in the brain, in the central, in the peripheral nervous system, no, or the CNS, including the spine na ganglion. Kasama yung sa mga muscles natin na nicotinic receptors will also be inhibited. O, nag-choppy ko. Hindi sulat manggod siya o your internet connection is unstable. Aling part doon yung i-repeat ko? So, dapat again sa drawing. Okay, again we have two neurons na per our both sympa and parasympa. And at the junction we have the ganglion where we can see the acetylcholine, and the receptor, the major receptor found there in the ganglion is the nicotinic receptor. Therefore, if you're going to give a ganglion blocking agent, this receptor will be blocked, will be inhibited, and the effect of acetylcholine, syempre, will be inhibited. So this is not for the ganglion alone, but other nicotinic receptors in our body, especially in our muscles, can also be inhibited. So yun yung magiging effect ng ating ganglion blocking agent. Now, the side effect or the toxicity of this ganglion blocking agent will just be a direct extension of their pharmacological effect as they inhibit the sympathetic ganglia and the parasympathetic ganglia. Kung ano yung mangyayari sa body, yung extension nun, meaning yung kung masosobrahan ka, hindi na siya magiging desirable effect, magiging side effect na siya. So first, if we're going to inhibit the ganglion in the sympathetic nervous system, we have the sympathoplegia. The patient may experience excessive orthostatic hypotension. Okay? Ang ano talaga class, ang effect talaga if we inhibit nicotinic receptor in the sympathetic nervous sympathetic ganglion will be the decrease in the blood pressure kasi there will be yung relaxation of the blood vessels. However, the excess of that, syempre the patient will be experiencing hypotension. So in this case, it's orthostatic hypotension. This is dependent in the posture, in the position of the patient. Kung nakatayo, pag there is a change in the position, pag nakahiga, biglang tatayo, there will be a sudden drop in the blood pressure. And that's when the patient experience parang nausea, or fainting during sa change in the position. And at the same time, since there is relaxation of the muscles for the sympathetic nervous system, males plus may experience problem with ejaculation. Okay? And even erection. Yan yung problem. Putol-putol. Choppy. Naghahinay siguro ang internet connection dito sa school. Sa last na kong giingon. Ang sarapit din to ang choppy everything. Tabang. Anyway, sige, ulitin ko na lang. When you say class, inhibition of the nicotinic receptor that will result in the relaxation of the blood vessels. That is why magda-drop yung blood pressure. Di makaya, Chappy. Hangtod karon Chappy, gyapon. What shall I do? Wait tayo for a while. Murag robot. Hintay na lang tayo for a while. Baka ma-okay lang yung connection. Hindi po ko sure sa recording kung mag-robot-robot po ba ni siya. Sige. Pwede na? Shopee paghihapon? Dili na, okay na? Sige. Let us continue. Asa na good to eh? Nakalimot na ko eh. Anyway, this one, sympathoplegia. Again, inhibition of the nicotinic receptor will lead to relaxation of our blood vessels. That is why there is a drop in the blood pressure, decrease in the blood pressure. However, extension of that, meaning if there will be excessive inhibition of this receptor, will also lead to excessive effects. And that will be called now like side effects or toxicities. So that is why we're going to inhibit the sympathetic nervous system na ganglion. The patient may experience excessive orthostatic hypotension. So, okay, there will be a drop in the blood pressure, especially during a change in the position. So, tinawag siyang orthostatic hypotension. And aside from the blood vessels, all the other smooth muscles will also be relaxed, and that will lead to problems, especially in males, in terms of their erection and ejaculation. Okay? So yun yung magiging effect sa sympathetic nervous system blockade. Now, how about sa parasympatho na effect or parasympathoplegia? Remember class, acetylcholine's activity is dumbbells, but we are inhibiting the dumbbells. That is the reason why for the side effects we have here constipation, kabaliktaran ng diarrhea. we have dry mouth, urinary retention, and there will be mydriasis. Therefore, there will be precipitation of glaucoma for patients with glaucoma and blurred vision. So all of these are just extensions of their actually pharmacological activity na sobrahan nga lang. Kaya naging toxicity. Okay? So what is the example of a drug classified here under the ganglion blocking agents? We have the mecamylamine, or the brand name available in the market is Inversin. So however, just like guanabenzene, guanfacine, this is also not really commonly used drug for hypertensive patients. Okay? So ano yung ginagamit natin commonly na mga drugs? Itong mga adrenergic neuron blocking agents, especially the alpha and the beta drugs or agents. Okay? So let's talk about adrenergic neuron blocking agents. Neuron ha? Adrenergic neuron blocking agents. Remember the neuron that releases norepinephrine is called adrenergic neuron. So if the drug has something to do with this neuron, we can also anticipate an effect on the blood pressure. So itong drug na ito can lower blood pressure by preventing release of norepinephrine. Okay? It will affect the adrenergic neuron, and it will in turn affect the production and the release of our norepinephrine. So we have here guanethidine, brand name in the market is Ismelin, which is actually rarely used. And since this has a very polar structure, the functional groups present in the structure are polar, then this drug cannot really enter the central nervous system. So unlike our clonidine and METHYLDOPA, this guanethidine will not cause sedation, depression, and all the other CNS effects. Guanadrel also is a guanethidine-like drug that is only available in the US for hypertension. Now, what about these two drugs? These two drugs will inhibit the release of norepinephrine from sympathetic nerve endings. If you can still remember our drawing sa adrenergic neuron na axon for the production of, ay, gano'n mo na siya. Wait. It can't enter. Pag polar ang drug, it cannot enter the blood-brain barrier. Okay? Sige. So remember class, norepinephrine will be produced here from dopamine that will be inside the vesicle. Is it familiar? Okay. Remember class, when we are going to release the norepinephrine, the process is called exocytosis. And that involves the opening of the snaps and the vamps. Remember these two, snaps and the vamps, are our gates here in the axon of our neuron. Okay? Again, Chapinasad. The struggle is real. Unsa can't enter? Unsa can't enter?
Well,
Kani guanethidine cannot enter the CNS because it's too polar. Pag polar kaayo ang drug, syempre hydrophilic siya. Hindi siya makakross sa blood-brain barrier. Wait lang kay lobat. Wait ha.